Hello, my name is Melissa Ma, and I'm a pre-doctoral research fellow at Northwestern University. And today I'll be talking to you about our work in conducting a needs assessment to prioritize the development of clinical practice guidelines for lasers and energy-based devices. While the utilization of lasers and energy-based devices continues to expand across various medical specialties, there remains a lack of standardized guidelines for their use in clinical practice. In the rest of medicine, there is an increasing effort to develop clinical practice guidelines which are based on evidence and serve as suggestions for treatment to ensure that quality care is provided to our patients while minimizing adverse events. ASLMS is a lead scientific organization within the field of laser medicine and surgery, and as such, it is fitting that we are at the forefront of this initiative. Our objective was to conduct a needs assessment to identify and prioritize clinical conditions in the field of lasers and energy-based devices for which guidelines will be developed. The ASLMS Clinical Practice Guidelines Task Force initiated this process by conducting an extensive literature review of existing guidelines pertaining to lasers and energy-based devices. The search terms for the literature review included laser, energy-based device, guidelines, and recommendations. From the search, 34 guidelines were identified, with the most recent addressing acne scars and laser-assisted drug delivery. The most common guidelines identified were on laser hair removal, vascular lesions, and scars. Following the literature review, the task force analyzed the results and convened a focus group comprising 16 expert dermatologists in lasers. Through collaboration and expert input, 6 priority topics were identified based on the lack of existing guidelines on these topics and the frequency of encounters of these topics in clinical practice. These include the safe use of lasers in children, laser hair removal, treatment of vascular lesions, and laser tattoo removal, and use of lasers in patients with skin of color. Recognizing the resource-intensive nature of guideline development, as developing even one guideline can take up to 1 to 2 years, the task force and focus group members further prioritized 3 topics to focus their initial guideline efforts. In prioritizing these topics, we considered several key criteria, including clinical significance and impact on patient outcomes, widespread use across multi-specialty and multi-level laser clinicians, and the potential harm or adverse events associated with inadequate performance of these procedures. The 3 guidelines that we prioritized were safe use of lasers, laser hair removal, and laser tattoo removal. The latter 2 are commonly performed procedures of which there are no national guidelines at present. These selected guidelines will not only benefit ASLMS members, but also contribute to national standards, particularly in the areas lacking established guidelines. In terms of how we're tackling this, ASLMS has established a structured approach to guideline development through the Guidelines Oversight Committee, which is comprised of chairs, co-chairs, methodologists, an expert panel, administrative support team, and a literature review team. The committee will ensure that the guidelines are developed in a systematic way to meet the rigorous methodology and standards set by the National Academy of Medicine for developing guidelines. Next steps include finalizing the Guidelines Oversight Committees, formulating PICO questions, conducting a literature review and expert evidence survey, conducting a Delphi consensus process, and at which point the guidelines will be finalized. In summary, the ASLMS Clinical Practice Guidelines Task Force conducted a needs assessment to prioritize guideline development for lasers and energy-based devices. The Guidelines Oversight Committees will commence work over the next years to develop guidelines on the safe use of lasers, laser hair removal, and laser tattoo removal. With these guidelines, we aim to enhance patient care and safety and standardize clinical practice not only for our members, but also clinicians across the country. Thank you very much.